Okay, so you heard it here first. If you mess up your box for your Cologuard unboxing, just call the 800 number and they will give you a new kit. And most insurance companies cover the Cologuard. Do you have a medical concern or perhaps a question or a situation that you think a retired nurse could help you with? Email me to the email you see on your screen. If you want to be anonymous, please let me know in the email and I'll see what I can do. Hello, you beautiful souls. Today, I thought we would do a Ask a Nurse because I was walking into the house and I looked over my banister, and over the banister into the trash pile there was this package, and this package is a Cologuard collection kit. So I said, this box was dripping wet. I had to rip away this one side of the label came off. Let's see what a Cologuard collection kit is. It contains instructions, labels, bracket, container, a 2 milliliter tube, a preservative, and it says here, Cologuard is intended for the qualitative detection of colorectal neoplasia associated with DNA markers. So what is qualitative neoplasia? Well, that's simply a big word or two words for the characteristics and nature of a tumor or an abnormal growth underneath the microscope. So I said to myself, let's unbox this. So today we're doing a Cologuard unboxing of a container that's been out in the rain for, I don't know. But anyway, it's here now. It's back now. Has anybody ever seen a Cologuard unboxing? Here it goes. So you get this blue bag, you unzip it. We have a Let's Get Started. We have a Cologuard patient guide. We have some labels to fill out, 2 of them in fact. And we have the instructions to follow for your return via UPS. Should be very interesting. We have a bracket that says place under toilet seat. Okay. Apparently I'm going to poop through that hole. We have a container. Open and close. Okay. Looks like it goes here. Alright. So this is going to go under my toilet seat. I'm going to put this container here. I'm going to open the lid and I'm going to poop in the container, apparently. Okay. We have some preservative water. I don't know. That must be some kind of special solution. And we have the tray with another tube. So, where to begin and make sense of all this? Here's a tube. Alright. Let's start with Let's Get Started. Okay. So, a quick guide on how to use your Cologuard collection kit ordered by your healthcare provider. Here we go. Alright. Check out the previous page where the kit components are pictured. Unpack all the components except plastic bag and white tray at the bottom of the kit. Okay, we already have a problem because here's the bag and here's the white tray. But let me try it. Let me put it back. Alright. So now, that's problem number one. See, it was out in the rain. So. Okay, so when unboxing your Cologuard, do not rip the blue bag out of the box like I did. But that's okay. We'll just put it back in the box. Alright. Like I said, it's been out in the rain, so half the box is messed up. So anyway, I hope they have a number I can call. Tip. Wait to collect your stool sample until you have no diarrhea. Excuse me. Tips. Wait to collect your stool sample until you have no diarrhea from illness and no blood in your urine or stool, such as from hemorrhoids or menstruation. Contact your healthcare provider if you have unexpected bleeding. Okay. Number 2. Empty your bladder before setting up the bracket. Place the bracket under the seat on the toilet bowl. Alright, so remember, this bracket is going to go under your toilet seat. Okay? And this container is going to sit in it probably. It looks like it does. Let's keep reading. Number 3, lower the toilet seat, unscrew the collection container lid by pushing it down and turning it counterclockwise. Okay, so I push it down, turn it counterclockwise. Not going to do it now because this is on the desk, not on the toilet seat. Okay. Once open, place the container in the bracket. Oh, like I did. Okay, good. Number 4, sit on the toilet and have a bowel movement into the container. Tip. Your stool sample doesn't have to be perfect. Okay? None of us are perfect. I always say that here. But should reflect whatever is normal for you. In other words, don't try to have a bowel movement like your partner. Don't try to, just be yourself. Be calm, take a deep breath, and just poop. Poop. Let it flow through you. Your stool sample should not be larger than the liquid preservative bottle. Wow. Let me tell you. If it's larger than this liquid preservative bottle, you have a big poop. Alright, so not larger than this bottle. And you can see this is pretty big. So, what if it is though? Like, do I cut it in half? I mean, you know how you have those long poops the size of your entire toilet bowl 3 times around? Because your intestines are 26 feet. So, like, what if my poop is bigger than this container? Longer than this container, anyway. Do I cut it? These are questions I have to ask. Don't worry if a bit of the urine gets in the container. Okay. 5. Unscrew the probe from the tube. Use the probe to scrape your stool sample. Completely cover the grooves on the tip of the probe with stool. So I'm not going to do that yet because I'm not ready to do it. I'm just reading the instructions. Place the probe in the tube and screw the cap closed. Okay. Then, number 6, pour the bottle of liquid preservative into the container. So, I'm going to, with the rest of the stool, I guess, I'm going to take this liquid preservative, pour it in here. Okay. Screw the lid back on the container. Okay, that's very important. I would imagine that's an important step because if it's going to be shipped, you want to make sure the lid is tightly screwed back on. That makes sense. Okay, tip. It's okay if the stool sample isn't completely covered with the liquid preservative. Okay, that's good to know. Number 7. Fill out both labels. Okay, fill out both labels. Labels are on this page, label 1, label 2. Place one on the container lid and one around the tube. So we have 2 labels. You fill out your name, your date of birth, the date, and the time. Okay, you put one on the tube and one on the container. One on this container. Okay, got it. Place the container and the tube back into the white tray in its original shipping box and dispose of all the other items. Okay, that's where we're going to have a problem because I took the blue bag out. Here's the tray, but also too, the box was ruined because it was out in the rain. So I don't know if that's going to be a problem. Close the zipper across the top of the bag to close. Seal the box with the attached adhesive strip on the box flap. Well, that's not going to happen because the rain ruined it. See? I had to throw half of it out. I bet you if I just went like this, and like that, it would be fine. But I don't know. Did I ruin it? Did the rain ruin it? I don't know. Seal the box with the attached adhesive strip on the box flap. Remove the top shipping label to expose the prepaid return shipping label. Nicely done. You're all set. Alright. So, I have to call the 800 number and tell them that the box is a little messed up because I ripped out the blue bag. And is that going to be a problem? It says if I need assistance, please call us at 844. Okay, let me call that number.
Thank you for calling Exact Sciences Laboratories. Para español oprima número 9. 廣東話請按7字。普通話請按8。Your call will be recorded for quality and training purposes. Please stay on the line for a brief survey after this call. If you are
Because cancer doesn't run in my family, so if it comes back positive, like, should I, be scared? So what is the percentage,
So that would, yeah, so I mean, the rate that I gave you, the 13%, is for false positives. So that's the rate in which typically those who didn't have precancer or colon cancer received a false positive. So I believe that's the number that you're looking for, the 13%.
Okay.
In terms of if you had a positive in regards to your family members, that's definitely something to talk to your provider about directly and what those next steps would look like.
So 13%, that's kind of high, but I'll take that up with the, it's good to know if it comes back positive, I don't necessarily have to worry.
Yeah, I mean, I would definitely follow up with a provider, even if you believe that it may be a false positive. Just so it's best to be, on the safe end of that there. But let me just
Oh, yeah, absolutely.
Kit for you? Okay.
So the box is ruined, so I need a
Okay,
kit.
perfect. So I went ahead and I shipped out a new kit for you, so you should see that here within about 3 to 7 days. If you don't see it by then, just give us a call. We can check on the status of that for you. Otherwise,
Okay.
is there anything else I can assist you today?
No, but thank you very much for answering the question with the 13%. I appreciate it.
Yeah, of course. You're welcome. You have a wonderful day.
All right. I hope everything comes out okay. Have a good day.
Same here.
Bye bye.